will it be safe to travel for the holidays? And do you need to bring your own sheets to a hotel? WBZ's Dr. Mallika Marshall joins us now to answer some of your coronavirus questions. Always nice to see you, doctor. Let's get right into it. Stephen writing on Facebook, I recently had blood work and a urinalysis. Does the COVID-19 virus show up in these tests?
So there is a blood test you can get to look for antibodies that will give you some idea of whether you've had prior infection with the coronavirus, but that's not a routine test that is ordered. You're also not going to find out if you're infected by looking in the urine with a urinalysis. However, the best way to find out if you're actively infected with the coronavirus is to actually have one of those nasal swabs. Some parts of the country, they actually do oral swabs as well.
All right. Another viewer says that he is 81 years old with end-stage kidney disease and heart failure, and he wants to know if he should fly from Boston to Phoenix during the Thanksgiving holiday.
I hate to say it, but I don't think that's a good idea. You're at risk for getting COVID-related complications for a number of reasons. And it's not just being on the airplane that might be risky for you. It's walking through the airports and going through security and possibly seeing friends and family over Thanksgiving. Unfortunately, I think it's going to be a lonely holiday season for a lot of us. But hopefully we can set up some Zoom or some FaceTime get-togethers over the next few months.
All right. Now, that is super depressing. And I think a lot of people are already looking ahead to the holidays, hoping that they'll be able to spend more time with their families. Liliana wants to know if she should bring her own sheets and pillows if she stays at a hotel.
That's probably not necessary, but I would make sure that you find a reputable hotel that actually cleans the linens between guests, which of course most hotels do.
How do you really know? That's my question. How do you really know? Rob writes that he has noticed that frequent hand washing and sanitizing has left his hands cracked despite moisturizing. Should he be wearing gloves, he asks, to prevent contracting COVID-19?
So we need to be moisturizing now more than ever with all the hand washing and the disinfecting. What I would do is choose a really emollient moisturizer, something as simple as petroleum jelly or Vaseline. That really does the trick. There's been some controversy about gloves because some experts worry that if you wear gloves, you could contaminate yourself with contaminated gloves. So if you're going to wear gloves, you might want to get disposable gloves and toss them after every use. Or if you're going to use reusable gloves, then you really do need to wash them in between times, just like you would wash your hands.
And I know this is viewer questions, but David has a question. Emollient. What does emollient mean?
Yes, David.
What does emollient mean?
That means like really greasy, honestly.
Really
Crisco
greasy.
works, anything that's really greasy. I like things that are greasy. Some people don't, but now is the time to use them.
Did you just say Crisco? Did you just tell people to put Crisco on their body?
Crisco works. Crisco, you can bake with it, you can put it on your body. It has a lot of good uses.
All right. Dr. Mallika Marshall. Mallika Marshall offers her best advice. But as always, consult your personal doctor before making any decisions about your health. If you have a question for Dr. Mallika, there are 3 ways to reach her. Her email is drmallika@cbs.com, on Twitter @Mallika Marshall, or Facebook message her. It's Dr. Mallika Marshall.